name is Dr. M. I am the cardiologist here. Nice to meet you. Okay, it looks like your primary care physician has referred you to me because of some heart abnormalities. Okay. Well, we will definitely get to the bottom of that today, okay? Alright, so I have your chart here. That was sent over to me. And I'm just going to go over a few things with you, and then I will examine you. Okay, so just verify your name and date of birth for me. Okay. Do you have a family history of heart disease? On your dad's side? Okay. Okay. And when did you start having problems with your heart? When was that the first time? Okay. And you were taken to the emergency room? At what hospital? Okay. Do you have any allergies to medications? Do you smoke or chew tobacco? Okay. So just looking over your chart right here, it looks like your primary care physician has already ordered the EKG, and I do have the results of that. Right? So the EKG results came back normal. That is the first line of cardiac diagnosis tests. So that was a perfect starting point. But I will go ahead and we'll kind of dig a little deeper to see if we can figure out what is causing the problem, okay? Okay. Okay. I'm going to listen to your heart real quickly. Okay, just breathe normally for me. Okay. Now I'm just going to listen to your lungs, okay? If I can just have you take a couple of deep breaths for me. And out. Okay. Deep breath in. And out. Okay. I'm just going to reach around you here in the back and listen again. Deep breath in. And out. Okay. I'm just going to listen on this side now. In. And out. Okay, I'm just gonna take your blood pressure now. If you'll just give me your arm. Okay, let's just roll that sleeve up a little bit. Okay. to just examine you for a minute. Okay, I'm just going to feel your pulse for just 1 minute here. Okay, now I also want to feel your radial pulse in your wrist. So if you'll just hand me your wrist. Okay, perfect. Okay, I'm just gonna feel under your chin, your neck with both hands, okay? Can you turn your head to the right for me? Okay, and then just go ahead and turn it to the left side for me for just 1 minute. Okay, what I would like to start with is a nuclear dye test, both in a rested state and in a stressed state. So what we will do is I'm going to go ahead and hook you up to our EKG machine so that we're getting the EKG results from the entire test, okay? I will also put a blood pressure cuff back on your arm. I will be taking your blood pressure throughout the test. I'm going to go ahead and get an IV started. I'm going to have you lay down while we start the IV. And what we will be doing is we will be injecting you with a small amount of radioactive material. We're going to let that circulate through your bloodstream for about 10 minutes while you're lying down, okay? Then we will move you into our cardiac CT machine, okay? At that time, we will have you sit upright, and for 15 minutes you'll sit in there while we are getting images of your heart and surrounding veins, arteries, and aorta, okay? The radioactive dye in your body will contrast with the tissues, making it easy for us to see if there are any major blockages, okay? Okay, I'm gonna go ahead and start your IV now. Let's just clean off this area in your hand. Okay, I'm gonna tie a tourniquet on your arm, just above your elbow, just until I find a good vein, okay? So go ahead and lay down. I'm going to inject the dye, and I'm just going to let you rest in here for a couple minutes while that circulates throughout your body. Okay? Okay, here goes the dye. It might sting a little bit just as I'm pushing it through. Okay, are you doing okay? Alright, I'll be back in a couple of minutes and we will get going with our CT, okay? Okay. Hi. Okay, we're gonna go ahead and get you back to CT. Okay, are you ready? Okay, go ahead and just sit up for me. Perfect. Are you comfortable like that? Okay. This will take a couple of minutes. I'm just going to be watching your images and taking some notes from the other side of the class. If you need anything, there is a speaker and we can hear. So just let us know. Okay. Okay, you're all done. Go ahead and lay down and we're gonna get you out of there, okay? Okay. Are you doing okay? Okay. I did not see any major blockages, so that's good. What I'm going to do now is we're going to repeat the same test. This one is called a stress test. And what I'm going to do is you're going to step on that treadmill right there, and you're going to walk for about 15 minutes. I will be increasing your speed, and you'll be at an incline of 15%. Now, that may not seem like enough to stress your heart out. We don't want to stress it out too much, but we do want to increase the stress on your heart so we can look more closely with the dye test. So we will go ahead and do that for 15 minutes. It is actually pretty difficult, so just go ahead and step on that treadmill for me. Okay, let me just fix this lead here that's coming off of your chest. Okay, and again, we will be taking blood pressures throughout this process. Okay, you ready? I'm going to start you off at a slow pace, and I'm just going to be looking right down here at the monitor. let me know if there's any problems, okay? Okay. You have about 1 minute left, okay? Are you doing okay? Okay. Okay. I'm gonna go ahead and slow you down a little bit. It looks like your heart rate maxed out at 163 beats per minute, okay? Alright. Okay. Go ahead and have a seat in that chair for me. We are just going to inject the dye one more time, okay? Okay, let's get you back into our cardio CT. Okay, this part is exactly the same as the first test we did. I'm gonna have you go ahead and sit upright. Perfect. I'm going to start the machine, and I'm right out here taking some notes in your chart if you need anything, okay? Okay. You're almost finished. You're doing great. Okay, you're all finished. I'm gonna have you go ahead and change out of that gown back into your clothes, and then just go ahead and take a seat in that chair, and I'll be back in a few minutes to discuss our next steps, okay? Okay. I did not see any major blockages at all during our testing, okay? That does not mean you are free and clear of heart disease. We can pick up blockages through these testings that are like 50 to 70% blockages. So it doesn't mean you're free of blockages. It means there was not one visible to us. So we don't need to take immediate action today. What I would like to do next is get you scheduled over at the hospital for a calcium score screening heart exam. That was going to show me if there is calcified plaque on your arterial walls. That can be just as big of a problem as a blockage, because if the plaque is on your arterial wall and it breaks off, that can cause bleeding, heart attack, or a stroke. So I would just like to check that as well, just so we know if there is calcified plaque and how much. Okay, I'm going to keep you on the same heart medications as Dr. Johnson has you on right now. I don't see any need to change those. I would like you to follow up with me in 6 weeks. By then, we'll have the results of that heart scan. Okay, also in the next 6 weeks, I am going to put you on a heart-healthy diet and exercise program. We're going to see what changes we see within 6 weeks. We should be seeing big improvements in just that short amount of time. Okay, so weightlifting is good for the body, but cardio is going to be great for your heart. So I'd like you to do cardio at least 5 times a week. This can be walking around the neighborhood, riding a bike, swimming, working out at a gym, taking classes. Okay? As far as your diet goes, I want you to eat a lot of fruit and vegetables and heart-healthy whole grains. I would like to limit unhealthy sources of fat and make sure that you're getting low-fat sources of protein. Okay? Great. I have some flyers that I will have my nurse bring into you about meal ideas that can help you with this. And I will see you in 6 weeks. Great. We'll see you then.